Hi, I'm Marty Guthmiller, CEO at Orange City Area Health System. It goes without saying that these are unprecedented times. Phrases like uncharted waters, long winter versus blizzard are common attempts at describing our current environment. For over 25 years, I have had the privilege of serving as Chief Executive Officer for Orange City Area Health System. There have been some tough times, but mostly really great times, including the opening of our new health system campus nearly 14 years ago. From the very beginning of my tenure here as CEO, and in fact, when I was interviewed for this position, I have embraced and relied on the do right philosophy I picked up from the great philosopher, fighting Irish Notre Dame coach Lou Holtz. It is simply this: first, do the right thing. Second, do it the best you can. And third, take care of other people the way that you would want them to take care of you. While this is a simple concept in philosophy, it is very difficult in execution. Every new employee who goes through orientation at our health system receives this philosophy from me personally. And it is a journey, not a destination. As an assurance to both those we serve and those who serve, our commitment to do right will not change, and in fact will be relied on more than ever as we move forward. Our health system is strong, from its mission to its people to its balance sheet. We are well positioned for this challenge. Beginning with our mission of serving health and well-being of those in our region, we are ready. There is no doubt about the significant psychological and economical impact of the COVID-19 outbreak. This, by all indications, will continue for the foreseeable future. But we will get through it together. What our actions are about now, locally and nationally, is minimizing the medical impact of this virus. There is a graph widely utilized that illustrates this visually: the strategy of slowing the spread of the virus so that the number of infections stay below the capacity of the healthcare system. It's called flattening the curve. By doing this, there is then adequate supplies, equipment, and personnel to care for infected individuals. As a health system, we are guided in these decisions by governmental bodies including CDC, CMS, and the Iowa Department of Public Health, or IDPH, as well as our own medical expertise and our moral compass. Many of you are aware of some of the measures implemented recently throughout our campuses. Recognizing that seniors are the most vulnerable, we have closed Prairie Ridge Care Center, which is our nursing home, and Landsmere Ridge Retirement Community to all visitors. All staff and essential personnel, including maintenance and delivery personnel, are medically screened prior to entering these facilities. Exceptions are made for end-of-life situations or on a case-by-case basis. We are well aware of the social isolation consequences and will continue to work on ways to reduce that impact to our residents and tenants. At the health system main campus and outlying clinics, we are eliminating, or at minimum reducing, elective procedures primarily to preserve valuable resources. For example, personal protective equipment like masks and gloves, in the event that they may be needed for more acute situations. We have also implemented strict visitation policies with exceptions for support individuals for births, emergency care, surgery, and end-of-life care. We have also closed the hospital cafeteria, our swimming pools, and the gift shop to the public. We thank you for your acceptance and support of these measures. Your understanding has been positive and overwhelming. We certainly do not take these restrictive matters lightly. We also do not take these steps out of fear or anxiety. Rather, we have implemented them to protect not only our patients and the public, but also our staff of nearly 600 dedicated colleagues. As in most, if not all, health systems, our staffing resources are limited. As they say, our benches are not deep. We have a finite number of staff, and we must protect them. Without our employees throughout our health system, our primary focus and mission, caring for others, is not possible. The courage and resolve of our physicians and caregivers, both direct and indirect, is nothing short of inspirational. They are an amazing group of individuals, and it is an honor to work beside them. Our team is well trained and at the ready to care for all of us who may be in need. We must ensure that they have all the resources at their disposal to not only care for you, but to protect themselves as well. I mentioned earlier the strength of Orange City Area Health System, from our mission to our staff to our balance sheet. I feel it is important to speak briefly to our balance sheet. In other words, our ability to weather the storm due to this viral outbreak. Many of the measures that have been implemented will soon have a severe negative impact on our revenue. Our cash reserves will allow us to take care of staff financially and secure needed equipment and supplies for the foreseeable future. While certainly not unlimited, we are well prepared to ride out this season and deal with rebuilding reserves at a later date. There are also a number of federal measures being proposed that may provide some assistance as well. In short, we got this. We are prepared as we can be, and we stand ready to respond as needed. Thank you again for your understanding and support of the measures we have taken to best respond to this current international situation. I hope my message to you today provides some level of assurance in this unprecedented moment in our lives. Take care and God bless.